Hello and welcome, ladies and gentlemen, to this very special segment today on the 27th day of December. Today we have lots to talk about, so let's get straight into the show. As we know that very, very sad news has come out of Brisbane. So a man who had Fiji at heart, but Fiji failed him and exiled him. Emeritus Professor Brij V. Lal passed away in Brisbane, Australia. Former Fiji citizen, a member of Reeves Constitution Commission who gave Fiji a constitution of national unity and one of the leading historians of Fiji. Emeritus Professor Brij Lal passed away in Brisbane. In a professional lifetime spanning more than 40 years, Professor Lal has written widely about Fiji and the Indian diaspora. He was 69 years of age at the time of his death, being born in Lambasa in the northern part of Fiji. Professor Lal was educated at the University of South Pacific in Fiji, the University of British Columbia in Canada, and Australian National University in Australia, which is in Canberra. Professor Lal was declared a prohibited immigrant in 2009 for opposing Bainimarama's government's false transparency and corruption-free society claims after the events of 2006 military coup. The indefinite ban has been placed on Professor Lal since 2015, which Bainimarama claimed was for opposing the return of Fiji to democracy and which has been continuously denied by Professor Lal. Even the leader of Federation Party, Professor Biman Prasad, has questioned the Fiji government for exiling the professor and continuously denying him re-entry to Fiji. In 1990s, Professor Lal served as a nominee for leader of opposition Fiji, Jairam Reddy, on the three-member Constitution Review Commission, whose work culminating in the adoption of the 1997 to 1998 government, a constitution which was opposed and not voted by Fiji Labour Party as they worked out of Parliament, and on the same constitution the Labour Party formed the People's Coalition's government led by Fiji Labour Party, and its leader Mahendra Chaudhry became Fiji's first Indian Prime Minister in 1999. Professor Lal helped draft the 1997 to 1998 Fiji Constitution, which was based on a government of national unity and opposed its abrogation by military leader Bainimarama in 2009. Professor Brij was a renowned Fiji academic and emeritus professor of Pacific and Asian history at the Australian National University in Canberra. Described as a distinguished son of Fiji and awarded the Order of Fiji Medal for his service to the nation, he had Fiji always in his heart, and in 2015 he reapplied for his return to Fiji. He was particularly critical of the military regime's decision for the expelling of Australians and New Zealand diplomats from Fiji. Prior to his death, he has been residing in exile in Brisbane, Australia, and Professor Lal has collated a series of his essays in a new collection that charts Fiji's past and present, and the lived experience of the Girimitia, who made Fiji their home. He had research interest in contemporary Pacific history and politics, Fiji history and politics, the 19th and 20th century Pacific history, culture and history of the Indian diaspora, comparative colonialism and constitutionalism, plantation societies and cultures, historiography and biography fiction, fiction and history writing, and Asian diaspora. At the time of his death, he was working on a large-scale project about Australia's engagement with the South Pacific from the 1940s to the 1980s. focusing on the Solomon Islands, Fiji and Vanuatu. Professor Lal stated that his research on Fiji continues with a historical dictionary and a general imperative volume of the University of Hawaii currently in preparation, along with a series of essays on politics and culture of the Indian indentured diaspora. On the side, I continue to wrestle with the problems of writing about societies with underwritten past. Professor Lal has taught history at the University of South Pacific, the University of Papua New Guinea, the University of Hawaii in Manoa, and the Australian National University, where he was professor at Pacific and Asian history from 1920 till 2016. He has many awards, which included being awarded as the Fellowship of Australian Humanities Society, Pacific Distinguished Scholar Medal, Centenary Medal of Government of Australia, Officer of the Order of Fiji, awarded as the Member of Order of Australia, and his selection as one of the 75 makers of 20th century of Fijian history. From writing journal, which means the articles, The Journey of Girmit in 2016, Island Business 12 and 13, Exile and a Land of Memory, Kai and Chen in Conversation with Bridge Lal, a Journal of Contemporary Fiji, and there are so many different books on facts and fictions that he has written or have been consulted on before other people have went on to write those journals, provide papers to other universities and other things like this. From being a member of Fiji Constitution Revision Commission, whose report formed the basis of Fiji's Constitution of National Unity, founding editor of the Contemporary Pacific, a Journal of the Island Affairs in Honolulu, and the Conversations in Canberra. He was the editor of the Journal of Pacific History, chairperson of Pacific Manuscript Bureau, founding director of the Center of the Contemporary Pacific. So, he had a lot to do in that field. And he was in the Division of Pacific and Asian History and former chair of faculty, Research School of Pacific and Asian Studies, deputy director of the School of Culture, History and Language, teaching experience, World and Pacific History at the Universities of South Pacific, Hawaii at Manoa, and Papua New Guinea before joining ANU in 1990 at the School of Culture, History and Language at the Australian National University. Professor Lal's research interest has been primarily focused on Fiji Islands contemporary, Fiji history, politics, constitutional development, Indian diaspora, India-Pacific, Fiji, and the politics. And internationally, Professor Lal was named as the 75th people who have helped sharpen Fiji's history in the 20th century and was honored by the Fiji Millennium Community of Fiji. Professor Bridge Lal has widely written on the indentured Indians of Fiji, and among his many books are the autobiography Mr. Tulsi's Store, a Fijian story, which won the San Francisco-based Kiriyama Prize in 2002. He has also authored Chalo Jahaji, on a journey through indenture in Fiji, which was in 2000, and edited Bittersweet, a Fijian Experience 2004, and later the two recounting of the history and the trials and triumphs of the Indian Fijian community. Professor Lal was also the editor of the Journal of Pacific History and the founding editor of the literature journal Conversations. In 2009, Professor Lal wrote the essay, Leveling Wind, Remembering Fiji, ANU Press. His essays are divided into three parts. The first part deals with the aspects of the indenture experience in Fiji. The longer narrative essays are followed by creative pieces that seek to explore the inner lived experience not documented in the archival sources. Part 2 explores aspects of recent political developments in Fiji and seeks to understand the patterns and processes of change at work. Professor Breechlal stated, "What I have sought to do in my work is to give voiceless people a voice, place and a purpose and sense of dignity and inner strength that comes from never giving up no matter how difficult the circumstances. History belongs as much to the vanquished as to the victors." Prior to his death and following his retirement, Professor Breechlal was residing in Brisbane, Queensland, with his wife, fellow academic Padma Lal. In 2015, Professor Breech was made a member of the Order of Australia at the 2015 Queen's Birthday Honours Australia for his significant service to the education through the preservation and teaching of Pacific history. As a scholar, author, and commentator, so he has done a lot, and today we remember him. I have had many conversations with him, and I've just dug out one of the first events that I helped promote with him, which was by the University of Queensland, the School of History, Philosophy and Religion in Classics, Fiji Coups and Crises, Where to from here? Professor Breechlal. This was held on Saturday, 28 November 2009 at the St. Lucia campus, Abel Smith Lecture. And prior to that, my first such dealing with him was way back when he came to Brisbane and he presented a piece at the Owl Customs House, way back, not knowing who he was. In the question and answer section, I did take up some questions with him. Later that night, to be invited, to a get-together by his family members here in Brisbane, only to find out who he actually was. So that was a chance meeting at that time. So, ladies and gentlemen, on Australian Indian Radio's this live channel, we'd like to pray him a tribute of what he has been able to do. And please stay in touch. We will let you know about the funeral details later on. Well, keeping in line with what's happening with Professor Breechlal, Dr. Breechlal, Desmond Tutu also has died at age 80. Here's that report.
Be free!
He championed the cause of the poor and oppressed and helped draw the world's attention to the injustices of apartheid.
When people decide to be free, then, dear friends, nothing, absolutely nothing is going to stop them from becoming free.
Desmond Tutu defied convention. He became the first black Anglican Dean of Johannesburg, the first black Archbishop of Cape Town, and ultimately head of the Anglican Church in Southern Africa. He pleaded for compassion during times of violence. His activism attracted widespread support and condemnation, but he insisted his motivation was religious, not political.
Many white people got very, very annoyed with me. I was putting it very mildly.
He always believed that the black majority would determine its own destiny.
And I am certain that when that day comes, it will be a day when we shall have, within 5 to 10 years, a black Prime Minister.
In 1984, he was awarded the Nobel Peace Prize for his role in unifying opposition against the apartheid regime.
Friends, fellow South Africans, I ask you, welcome our brand new state president, out of the box, Nelson Mandela.
A decade later, he was celebrating the birth of South African democracy.
Victory is ours, all of us, black and white together. Incredible! Woohoo!
He stressed the need for healing and chaired the Truth and Reconciliation Commission, encouraging the country's diverse races to unite as one. Desmond Tutu coined the phrase, the Rainbow Nation.
People will say he loved, ha 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 ha, he loved and he cried.
In the words of Nelson Mandela, Desmond Tutu was sometimes strident, often tender, never afraid, and seldom without humour.
Oh, God has a wonderful sense of humour, don't you think? Yes.
God has a wonderful sense of humor. What words, to live by. His legacy would forever live by, and, the teachings. So when you look at that conviction which he had when he meant that one day we will have a black Mr. and Nelson Mandela came along. So, that having that faith moving forward is what he has been able to do. Well, how has Christmas been celebrated worldwide in a pandemic situation? Here's that report.
This picture's not
The royal touch just for Christmas. The Duchess of Cambridge debuting her piano skills to the public during a special carol service.
can be here.
She gave birth to her first
Her husband took a more formal role.
wrapped him in bands of cloth and laid him in a manger.
You know what your sister...
The Bidens filled in as Santa's helpers, taking calls for St. Nick's hotline.
He wants a horse.
A horse.
At Bethlehem, the show went on. The town usually welcomes at least 3 million visitors during this time. A fraction of that this year, but enough to still feel festive at Manger Square, the traditional birthplace of Jesus.
Although there's a pandemic and things are hard, we just want to enjoy Christmas and spread joy around.
Meanwhile, churches took no chances. This congregation in Paris was greeted by their priest, as well as hand sanitizer.
I'm worried. It's very contagious.
The devoted and the daring gathered in Vatican City, all wishing for the same thing.
I hope for a return to normality, because this is not a life we can call normal.
Inside St. Peter's Basilica, Pope Francis spoke of humility.
We must contemplate what is central, beyond all the lights and decorations.
Although a fifth of its usual size, the 2,000 people inside were counting their blessings.
I think I'm lucky to get to see this, and especially during COVID.
But many won't reach their families this year. Nearly 4,000 Christmas Eve and day flights were cancelled across the world due to rising cases. Since flying may be a gamble, Santa is taking no risks. From swimming with sharks in Brazil to riding an elephant in Thailand, he'll still be coming to town. Nayan Kim, ABC News.
And thanks, ABC, for that report. Well, right now, let's take a look at what's happening here in Queensland and what our numbers are.
So in the last 24 hours, we've had 714 new cases to report in Queensland. This is slightly fewer than the preceding 24 hours, and it almost certainly has something to do with Christmas, perhaps people not coming forward to get tested over Christmas. So it won't surprise us at all if in the next couple of days the numbers get substantially higher, and we would not be too concerned about that. That would not be a surprise. It is still very interesting that there are only 7 patients in hospital who are there because of symptoms of COVID, and no cases in the intensive care units or on ventilators as of last night. That's despite having 2,857 cases of COVID currently active in Queensland. As you've heard, this brings the Queensland total to 5,032 cases, so more than half of the cases we have seen in Queensland we have seen since the waters opened last week on Monday the 13th of December. In terms of testing, there were 29,918 tests completed yesterday, and I really want to thank everybody who came out on Christmas Day to get tested in the warm weather. So thank you very much for those people, particularly those who may have had symptoms of COVID, who've come forward to get tested on Christmas Day. The case locations, again, right across Queensland, they haven't changed, so I'm not going to go through the list of LGAs again. They're right across Queensland, from the north to the south. What strains are we seeing? It's about 75% of the viruses we're seeing are the Omicron strain, sort of stable at that percentage, around 75% Omicron, about 25% Delta. We're moving more and more patients out of hospital, people who've been stranded in hospital because they have nowhere else to isolate. So we have 714 people who are being managed very, very successfully at home with mild symptoms of COVID. We still have 93 patients in hospital, which includes the 7 who are actually symptomatic, who still have alternative places that we need to move them to. They may have other medical conditions, for example, but happen to have COVID. There are other reasons why they're in hospital. But at this stage, only 7 patients who are admitted to hospital with symptoms related or directly related to COVID, and none in intensive care, none on ventilators. In terms of vaccinations, being Christmas yesterday, neither the state nor the Commonwealth reported vaccination rates yesterday. I was asked a question yesterday about hospital staff and who are in quarantine or who have tested positive for COVID-19. We have tens of thousands of healthcare staff in Queensland, so it is not at all surprising that some of them will get COVID, and that will continue to be the case, and that those numbers will rise. As of last night, there were 55 hospital and health service employees who have been confirmed to have COVID, and just over 300 hospital and health care staff are in quarantine as a result of a close contact, either in the community or in the hospital environment.
So as we have seen, 714 new cases there, and as was reported that due to the Christmas and Boxing Day, there were not that many tests conducted. So in the coming days, we will get a more clearer picture of the situation as it happens. As we know, and was said before, that it is likely that the numbers will grow and that the hospital systems will be put on a situation of being ready to cope, and that also brings into question the frontline workers and all the staff, as one of the questions which was asked in the last report. Well, the management of this Omicron, how have we done? Have we been proactive? Did we act in a timely manner? Here's that report.
Mary Louise McClure, always great to have you on the program. Good morning. Now, restrictions are being tightened in South Australia and in New South Wales, as we just said. What difference will those measures make in those states?
Well, Joanna, these measures may slow down the spread. It may help with contact tracing, but certainly contact tracing seems to be less active and less deep than it used to be before, and people are receiving messages asking them to potentially watch themselves and get tested if they start getting symptoms, rather than actually previously requiring them to go and get get PCR testing immediately. I personally think, looking at outbreak management, that this is too late. Quite frankly, in outbreak management, you look at behaviour, and you have to factor in behaviour change for things like super spreading events. And, in Australia, we adore Christmas break, regardless of where you come from, what your culture or religion is. Christmas break is so important here for socialising, and therefore there should have been better planning for ensuring that the obvious acceleration on about the 8th of December into this fourth wave could have been controlled, using things like rapid antigen testing to cross borders rather than PCR testing 72 hours before anything can happen in 72 hours. And of course, the mask wearing in public. You know, I've noticed on TV people attending the cricket were not wearing their mask as they were outside, getting into groups, getting excited. And this is the sort of thing they don't think is problematic because they're with their friends. But their friends can easily and inadvertently give them infection and give others. So it's really important for people to understand that even though there's this idea that Omicron is milder and let's hope that the UK evidence shows that it absolutely is. You wouldn't want to give somebody Omicron if they have somebody at home who has cancer or is unwell or is elderly. So I would have expected mask use, QR codes to continue, and certainly giving out free rapid antigen testing to everybody so they could have used it before they went out to social events such as the cricket and other sporting events and of course Christmas gatherings.
We are seeing a huge strain on testing clinics at the moment, particularly in New South Wales. We've got huge queues of traffic we can see now. That's what's happening, particularly in New South Wales. What can be done to help ease that strain on testing clinics?
Joanna, we noticed this last year when there was an outbreak in the Northern Beaches. Australians go to get tested, when they're asked or when they think they have to. So they need to be congratulated for this. This is fantastic. However, again, there should have been some planning to understand that Australians would want to go out and get tested before they went to see their families because they're very responsible people. But they haven't done that in New South Wales or anywhere in Australia. So they should have been giving out free rapid antigen testing from pharmacies so that people can use those if they don't have symptoms. Now, please don't use rapid antigen test if you have symptoms. They are fantastic for screening, that is to ensure that you are negative when you feel negative before you go somewhere. And that would have helped especially to reduce the cost of a PCR and the cost of staffing as well.
So the bottom line there is that we could have done better and we could have acted a little bit earlier. And I do agree with the point that she made about the break, that, we so treasure that break that we do anything, to be together with all the ones. So the numbers will grow, as she mentioned. Well, right now, such has been the case in South Australia, where the new restrictions now in place.
It's beginning to feel a lot like 2020.
We are increasingly concerned about the new Omicron variant.
While it appears to be less severe, the virus variant is spreading like wildfire, particularly among people who are unvaccinated or yet to have a booster.
And if we're not careful, we're going to have two consequences of Omicron. Number one, it will overwhelm our health system in Australia. Number two, it will seriously undermine our workforce's ability to respond to this Omicron outbreak right around the country.
And as a consequence of that, from midnight, gyms in South Australia will drop to one person per 7 square metres, and cafes and restaurants will revert to one patron per 4 square metres, all venues that have been responsible for so-called super spreader events.
Now, it's nothing to do with the hygiene or anything else that hospitality venue has done. It's just the fact that when you've got a large number of people together and there's talking and there's no mask and people are eating and drinking, that the virus spreads very easily.
A day after Christmas, household gatherings will shrink to a maximum of 10 people ahead of New Year's.
We rely on people to do the right thing. By and large, we see that. Clearly, if people don't choose to follow the direction, there is a likelihood that we will get complaints and we'll respond to those complaints.
2 doctors have tested positive with implications for hospitals. And across the aged care sector, at least 35 residents and 16 staff are infected. And 40 clients or staff in disability care have the virus, including several workers at Minda.
We've been supporting them as many of their staff have become close or casual contacts, and we've just got to make sure we maintain that workforce.
Our concern would be
they can't staff one, what happens when there's 2 or 3 or 4?
Nearly at every juncture, Stephen Marshall has meant that South Australians are doing it far harder now than what they should have been.
There'll be less hardship for travellers heading into SA, no longer needing a pre-arrival PCR test.
We are going to ask those people travelling back from interstate to make sure that they use one of the rapid antigen tests which are widely available interstate.
A lockdown remains off the cards for now, but the government says people should think twice about heading into the office or travelling around the state.
It's certainly not our intention to have a lockdown in South Australia, but it is our intention to very significantly reduce mobility at this time until we can get more shots into the arms of South Australians.
With 3 people fighting for life in the ICU, it's another wake-up call for a COVID-weary community.
Yeah, and it is a wake-up call, as we know. Well, right now we'll go to the, the emergency bushfire warnings that have been placed in place as well. So, from one crisis to another.
The fire was first reported about 3:30 yesterday afternoon, and it quickly went up to emergency level. Authorities were very, very concerned about the ferocity of this blaze as it tore through the region. We quickly started to see aerial vision of homes being destroyed, properties being destroyed, leaving behind little more than rubble, sometimes just minutes after the fire first reached that area. So crews have been working hard to try and do what they can to protect properties, bring this blaze under control. An evacuation centre was set up here at Mundaring Arena. You can see some people behind me. They don't look like they're taking things very seriously. They're having a bit of a party in the car park here, but certainly they were very concerned when I spoke to them earlier. Here's some of what they had to say.
When we were in the water, the announcement came over that we had to evacuate immediately. The fire was fast approaching.
Didn't first sort of knew something's happening when the helicopters come over, started sucking the water out of the lake, and we said, oh geez, and then the speakers, the lake caravan staff really good there and just called it out, said yep, time to evacuate, the fire's coming, and come out here and hang out here for a while. Yeah, it doesn't look good.
Conditions are expected to be very tough for firefighters today, temperatures reaching up around 39 degrees, so they've certainly got a big job ahead of them. And for many in this area, it's bringing back memories of a similar blaze that tore through the region in February of this year. That fire destroyed 86 homes and razed 11,000 hectares of land here. So it's been a very tough year for people in this region, but hopefully firefighters can get a hold of this fire quickly.
Yes, that report there from Western Australia. Well, right now it's time to go to our functions and events, and after that, should you remain on the show, we'll bring you some glimpses of Noosa, where we spent last couple of days. So, yeah, we will bring some glimpses if you so wish to see that right after we run the events. Here they are. Ladies and gentlemen, there you are, the upcoming events. I do apologize. There's some of the events which have just happened because we are in the holiday period, and all the upcoming events, they need to be really updated. Well, right now, as I promised, here's a little bit of a bonus of some clips from our recent trip to Noosa. Well, ladies and gentlemen, that's about all we have for you in this segment. Hope you've enjoyed today's segment. Of course, we had the special tribute there to Professor Breach Lal and Desmond Tutu, and so there's a bit of glimpses of the sorts we had from Noosa. So once again, wishing you all the very best. It's a good day here in Brisbane, 28 degrees, mostly sunny. Make the best of it, but make sure that you do observe all those safety precautions, remain healthy, maintain those social distancing, and now, unless it is absolutely not necessary, meaning it is always necessary, do have the mask on out there in the public. So until tomorrow, it's goodbye from me.